Kongololi eng taonitab Eldoret komwa CEO nebo sipitalitab boror nebo Moi Teaching and Referral Hospital Dr. Wilson Arwasa kole kibeti biik chesire 700 eng emet komugul kobun kaimutiet neibetegei biik sobonukwak anan suicide.
We get about 700,000 deaths. That's almost 1 million deaths per year, which are preventable really because of suicide. And in our country here in East Africa, we do not have clear data. And in fact, that's one of the reasons the Ministry of Health has started, as there is a team with Dr. Dorcas representing MTRH to look into the suicide prevention policies and interventions that are required. And one of them will be just to collect proper data. We do not have proper statistics as a country.
Okay, so we looked at the triggers. Most of them were mental illnesses, like we said. Those which had not been diagnosed. So we diagnosed them at the time that we were doing the study. And then financial burden, chronic illnesses, and then there are those who had attempted suicide before.
Kama Dr. Arwasa kole kiiti biik mut kila betut eng sipitali notok bo boror kobun kaimutiet notok ole mitei maget noton bo ketoret biik eng komoswek tugul.
We see up to even 5 in a day people who have wanted to commit suicide, particularly using organophosphates, sometimes hiyo ya kujinyonga, ya using a rope and other instruments. 18 to 34 years old. Those are the majority, and also a good number of them have mental illness.
Kamite koratak pa World Suicide Prevention Day, Women Rep nebo County nebo Uasin Gishu Gladys Bosholei.
Currently, suicide is a criminal offense. Attempted suicide is a criminal offense, but I'm one of the people who have said we should decriminalize suicide because that person has had the suicidal tendencies as a result of a mental illness or alcohol abuse or drug addiction or one of those. So we do hope that that can be able to change and also for people to begin to have more access to treatment.
Rirtoe shole kaimutietab eisetab maiyek ak boisietab kerichekab bokitet neikoityi kobetegei biik chechang sobonukwak.
Because of the prevalence of the illicit alcohol, there is more cases of depression and mental illness. But this is where our own security officers have failed us because they all know that those bars exist. They know that illicit alcohol is being sold there, yet those people continue doing business because they are in cahoots with the chief and the security forces. So it's important that we get our security forces to also be more sensitized. And lastly, we also want to try and make it compulsory for people to have a mental health assessment when you are taking certain jobs.
Kong'etikei taonitab Eldoret eng county nebo Uasin Gishu logoiwekab emet nebo Kass kainenyu ko Isaac Kogei.